Next, I would like to welcome the organizing secretary, Mrs. M. Satyakala, Assistant Professor, VMACON Mission Annapurna College of Nursing, Salem, for her great effort in organizing this conference. I welcome you, ma'am. I welcome all the HODs and faculty members of VMACON Mission Annapurna College of Nursing, Salem, for enthusiastic participation in this conference. I welcome you all the madams and sirs. Next, I welcome all the participants in the conference. We are truly delighted with your presence. I welcome all the delegates from different places of global. Finally, I welcome everyone in this conference. Thank you.
Thank you very much, ma'am, for the wonderful start. Welcoming up our next person is much awaited item in our schedule because now it's time to pay attention to unfolding the theme. Speaker, and it's my honor to invite her to unfolding the theme. Let's invite Dr. K. Maheshwari, ma'am, Principal of VMACON in Salem. Please, ma'am, for unfolding the theme.
Thank you, Intimandi. Very happy morning to all of you. Our beloved, honorable, and dynamic personality, our Vice Chancellor, respected dignitaries, respected IQAC Director, our eminent speakers from various countries, faculty members of VMACON Mission Annapurna College of Nursing, most valuable participants. Nursing is a noble profession. Quality paradigm in nursing is the title of that international web conference. Nurses are master the difficulties of care and advanced technologies in greater number to make the critical decision and support well-being of all. Quality is very important in health aspects. Keeping this view, the conference focuses on the quality improvement in nursing education, nursing practice, nursing research, and also in nursing management and administration. The conference also focuses on the quality improvement tool, barriers in quality improvement, and the quality improvement and technology. It will be definitely helpful for all the nursing personnel working at various fields. Thank you.
Thank you, ma'am, for your amazing theme unfolding. Dear Excellencies, we are moving into the next session in our agenda. Success is no accident. It is a hard work, perseverance, learning, studying, sacrificing, and most of all, love of what you are doing or learning to do. It is our honor to invite our Vice Chancellor, Professor Dr. P.K. Sudhir sir, PMR of DU Salem, to deliver inaugural address. Sir, please.
Can you hear me?
Yes, sir.
Yes, sir.
Okay. Respected Principal, VMACON Mission College of Nursing, Dr. K. Maheshwari, Dr. Jnanashekhar, our IQAC Director, today's resource persons, Professor Pachiyamma, Principal, Srinivasa College of Nursing, Mr. Swamivel Seduraman, faculty from Qatar, IQAC Coordinator, faculty members, students, delegates from other institutions, ladies and gentlemen, a very, very good morning to all. It is my great privilege and pleasure to be here on this inaugural function of this International Webinar Conference on Quality Paradigms in Nursing, organized by the VMACON Mission College of Nursing, a constituent college of VMACON Mission Research Foundation, deemed to be university. With utmost happiness and joy, I officially inaugurate this international web conference. I am happy to note that VMACON Mission College of Nursing Salem has come out for organizing an international conference on quality paradigms on various topics like quality initiatives in nursing management, performance appraisal system, quality tool, quality healthcare in nursing practice, barriers in quality improvement, quality improvement model in nursing, quality control agencies, quality practice in nursing research by inviting most eminent experts from India and abroad. National education policy promulgated by Government of India has given due weightage for quality in education sector. UGC has also come out with their mandate in quality improvements in quality research, induction program, industry connects, examination reforms, etc. And there is a cry for quality in all concerns now. Quality is a constant effort to achieve excellence in specific domains. We all know nursing is a service sector. Providing quality service and striving for excellence are ethical responsibilities of healthcare professionals. Nursing is a human care profession. And nurses are vital to continuous quality improvement in healthcare. Focus on quality improvement in healthcare can also better prepare an institution to handle a large-scale emergency or medical event as illustrated during the COVID-19 pandemic. I'm sure this conference provides a interdisciplinary platform for researchers, practitioners, and educationists to present most innovations and trends in the field of nursing education, administration, practice, and research. Let me take this opportunity to congratulate the principal and the entire team for organizing such time-needed web conference by inviting experts from different parts of the world. I'm sure at the end of this 4 days conference, the participants will be motivated on quality parameters in various aspects of nursing. I wish this 4 days conference have a very good deliberations on quality parameters in research and a grand success. Thank you. Thank you very much.
Thank you, sir, for your appreciation. Thank you very much, sir. Your presence here is a valid one. We know that you are packed with a tight schedule, but nevertheless, you made a way here and is of a great spend to us. Thank you, sir. Hardworking is gateway of success. Every successful person has a painful story. Every hardworking person has a pain, but they do not show in their face. They hide it in their heart and keep smiles. So it's our privilege. It's our pleasure to invite our Director of IQAC, Dr. P. Gnanashekhar sir, VMRF DU Salem, to facilitate the gathering. So please.
Thank you. Morning, all of you. It's a privilege and honor to be before all the learned people from the nursing profession on this international web conference on quality paradigms in nursing. I'm happy that this is first such conference to be organized by the university on quality paradigms. So in fact, I'm really happy to thank the principal and the IPS coordinator of Annapurna College of Nursing for taking up this wonderful international conference. It would have been fine if this conference had been conducted physically, but the pandemic has forced us to do it online. Though it is online, we are able to see plenty of faces, not only from our institutions, but also from outside VMRF. It's really wonderful. And I see the topics chosen and the resource persons everywhere there is quality. And it gives us a really wonderful feeling when we link quality with education. And specifically in nursing education, when we talk about quality, I remember what Florence Nightingale has said: everything which succeeds is not the production of a scheme, of rules and of regulations made beforehand, but of a mind observing and adapting itself to wants and needs. So we want the mind which adapts itself to the wants and needs of what the society needs today, that is quality healthcare. So it's the right time that you people have chosen such a wonderful conference topic. I wish all the participants a wonderful 4-day conference, and all the resource persons, I thank them for taking this wonderful job. And both the IPS coordinator and the principal, it's really good that you have taken this at this point of time when our university is going for the NACP team visit. I wish the conference all the best. Thank you, Ananda.
Thank you, sir, for your valuable and motivational speech. As we bring to close end of our inaugural session, I like to Mrs. M. Satyakalama, Assistant Professor, BMS EON Salem, to deliver the vote of thanks.
Thank you. Such a prayer that cannot be seen or touched. To be felt by heart, I felt honored and privileged to get the opportunity to propose vote
our VMACON Mission Annapurna College of Nursing, Salem, in this special occasion. First, I would like to thank our Honorable
express our sincere thanks to our Pro-Chancellor, Honorable Dato Sri Dr. S. Saravanan, for his solid support and motivation. Thank you, sir. I extend our heartfelt thanks to our today's chief guest, respected Vice Chancellor, Professor Dr. P.K. Sudhir, VMRFDU Salem, for his despite of his busy schedule, has found time to grace this occasion. I take immense pleasure in extending our sincere thanks to Director IPSC, Dr. P. Nanasegar sir, VMRFDU Salem, for constant motivation and remarkable presence. Thank you, sir. I give my sincere thanks to our principal, Dr. K. Mageshwari, for awakening the patients and despite to support us as a ladder to learn the whole of session. Your constant encouragement has helped us in the best way. Thank you, ma'am. I extend very heart gratitude to all the resource persons for gracing your crucial work and making this conference very meaningful and interesting. Thank you, everyone. I am very happy to express a vote of thanks to our IPSC coordinator, Dr. R. Naganandani, VMACON Salem. She always motivated me and she has done for me till today. Thank you, ma'am. I would also thank our general organizing this international conference. Once again, I thank you to all gathered here. Thank you.
Thank you, ma'am. We are thanking each and everyone who have attended our inaugural session of the International Web Conference 2021. Thank you for accepting our request and timely cooperation to give a great success for the ceremony. Thank you once again.
Thank you, sir. Thank you, sir.
Thank you, sir. Thank you, madams. We are moving to the day 1 scientific session. Delegates be on this.
Ma'am, good morning, ma'am. Ma'am, can you join, ma'am?
Dear ma'am and dear delegates, session will start within 5 minutes. Resource person is joining now.
ये फाइल रख के जाओ आपके सामने जमा करके
इसमें डाल दो मीटर के पास यार दो
Dear ma'am, HML ma'am, shall we start now ma'am? HML ma'am, shall we start the session now ma'am? देखो ना अरे बस नहीं है थोड़ा बड़ा Dear delegates, kindly mute your audio. Don't use the screen. Don't scrap the screen.
3 15 1868. Okay.
HML ma'am, are you able to audible ma'am? Yes ma'am,
Yeah,
are you able to hear? Yes ma'am.
Good
Yes,
morning.
ma'am. Good morning ma'am.
Can you-
For few minutes ma'am, we will start the session with
Okay.
introduction. Okay ma'am. Okay. ma'am.
Okay. And can you hear my voice?
Yes ma'am. Yes ma'am. Audible only.
It's
Audible.
audible? Okay. Fine.
Audible only ma'am. Only
Okay,
few
fine.
minutes ma'am.
Good
We will
morning.
start. Good morning ma'am.
Okay.
Dear madams, dear delegates, respected our principal madam, all the faculty members of VMACON Mission Annapurna College of Nursing, and all the resource persons, warm welcome to all. We are in the day 1 scientific session, first session of today, international web conference.
Thank you. धन्यवाद. अभी तक ग्री को दिक्कत अटेंड करके बढ़ना वो नया फोटो है हम आगे फोटो अपने फोटो आप देख रहे हैं इसमें आते सबको दिखते रहते हैं
सोचते हैं फालतू
We have two sessions today, 10 to 11 a.m. Quality Initiative in Nursing Management and Administration, which will be delivered by this Professor A. Pechiammal, Principal, Srinivasan College of Nursing, Siruvachur, and also Dean of Allied Health Sciences, Dhanlakshmi Srinivasan University, Trichy. Next, second session is 11 a.m. to 12 noon. The topic is Performance Appraisal System, a quality tool. The session will be dealt by the Mr. Swamivel Seduraman, Graduate Registered Nurse, Hammond Mental Health Hospital, Qatar. We move on to the first session as Quality Initiatives in Nursing Management and Administration.
கிளாஸ் பண்றதல்லடா ரிவிஷன் சைன் பண்ணனும்.
The madam has completed her diploma in nursing in the Madras Medical College and post-basic BSc nursing in the year of 1986 to 1989 also in the Madras Medical College under the Dr. MGR University. MSc Nursing OBG in the year of 2004 to 6 Madras Medical College. Completed training for early detection and management of breast diseases conducted by Multipurpose Health Advisor Training School. Participated in many medical and nursing and pharmacy education programs. Completed training course on health management information system. She has participated in family health awareness training programs, and she got that certificate of appreciation for working in Varamun Kopam program in Trichy district. She has awarded the first woman executive in Trichy district in the year of 2004. Madam has 34-year experiences in the field of nursing, which include 20 years of experience in the teaching and administration and 9-year experience in clinic practice. Obtained undergraduate and postgraduate degree from Madras Medical College, Chennai. Clinical experience in the field of intensive care unit and toxicology in government setup for 9 years. Served as maternal and child health officer in Trichy district for 17 years, which includes teaching and administration for nursing personnel. 13.5-year experience as principal in a nursing college. I welcome you, ma'am, to deliver your session. Ma'am, you can share your slide, ma'am. Ma'am, able to share? Yes, ma'am.
कब लिखेंगे? इसमें उतारेंगे जो भेजा जाएगा वो खाली पढ़ लेंगे, कुछ नहीं छापेंगे, जो भेजा जाएगा वो खाली पढ़ लेंगे।
ஒரே மாதிரி போட்டோவா? ரொம்ப கிளீன்ஸ் போட்டோ கொடுக்குறேன்.
Hello, ma'am. Ma'am, are you able to see my slides?
Yes, ma'am. It is visible,
See my
ma'am.
slides, ma'am?
Yes, visible, ma'am. You do one thing, ma'am. You make your phone in that landscape, ma'am. Rotate the phone. In that above options are there, no, ma'am, in mobile.
Okay. Yeah. Now it's okay. Now it's okay, ma'am.
Yes, ma'am. Keep straight, ma'am.
Now
Your mobile. You go to the above option, auto rotate, no, ma'am. Yes, yes, ma'am. Now you share the slide.
Now, ma'am. Ma'am, now it's okay.
This is one letter.
Yes, ma'am. Yes, ma'am. Yes, ma'am. It's
Okay.
coming. It's coming. Slowly keep down, ma'am. First slide only. start from first slide. Huh? Now the second slide is visible. Okay. Yes,
Good
ma'am.
morning.
Yes, ma'am. Very good. Start, ma'am. Thank you.
Good morning. I'm the assignment as quality nursing management administration. As nurses, it is our prime importance to deal with the quality in nursing. Program deals with the and the dimension of a quality health care, patient safety, quality standards for health provider, organization and implement a quality improvement program in the healthcare settings. So then comes to the meaning of quality initiatives. This healthcare is a set of focused activities designed to monitor and improve the quality processes in order to improve the healthcare outcomes in an organization by gathering and analyzing the data in the area and efficiently implement the change. So the quality important focuses patient safety, quality improvement, and framing and quality improvement activation. So, starting as a nurse manager and administrator, we should focus on quality, which is most important. Particularly, and we have to have a piece of paper for the map as well as the patient. And
मटेरियल नहीं देख रहा, पिक देख रहा, कौन बोल रही है यहाँ पर? मतलब ये दिख रहा है 101 की तरह ये इतना
we have to do the improve patient care and work environment. We should
जो करना बट रिपोर्ट देना हम
we
are नहीं अबे आ गया
is possible.
I'm sorry, ma'am. Please try to will arrange for the same.
Use the data and performance is most important. That's all. And we can make work.
इसका ये
अरे भाई 1:30 बजे 2 बजे तक चला गया, तो सुने सुनेंगे कर दिए अपना।
So as responsible and through that we can able to do the better care. So and we should have our own education. Educate the public, educate the patient, educate the relatives.
Ma'am, sorry to disturb you, ma'am. Voice is too breaking, ma'am.
गोली मार दिया यूनिवर्सिटी में।
Voice is too breaking, ma'am. Pechimal, ma'am.
Ma'am, actually, I'm getting lot of noises from your side, ma'am.
Yes, ma'am. The different resource person. 2 minutes, ma'am. We'll control from that. Only 2 minutes, ma'am. You hold on the line, ma'am. Okay, ma'am.
उजन मोट की आई थी वो
साइड में इतना
पता नहीं, हम भी नहीं चिंतित थे।
दुगो आई थी यहाँ पे विश्वविद्यालय के
वो नहीं थे।
Dear participants, kindly mute your audio. Otherwise, you remove from the conference session. Dear participants, kindly mute your audio. Cooperate the session.
पुलिस भाई मेल रहोगे ना ऑफिस में तबे तुम्हारा रुतबा है, नहीं तो फीमेल को तो और ज्यादा दिक्कत है। फीमेल सबको हमने एक दिन देखे नहीं पटना में जो हुआ था, जहाँ पे मेन हेड है वहां पे दुगो घुसवा के उस सबसे डांस करवा रहा था भोजपुरी पे। इंग्लिश में बोला। हाँ, घुसवा के दो घुस के डांस करवा रहा था। जबरदस्त।
Ma'am? Ma'am, Pechemal, ma'am? Are you in line, ma'am? Pechemal, ma'am? Ma'am? Yes, ma'am. Continue, ma'am. Continue, please, ma'am. Sorry for the disturbance, ma'am. Please, ma'am. Ma'am, am I audible? Please continue, ma'am. Ma'am, Pechemal, ma'am. Pechemal, ma'am. Ma'am. And Pechemal, ma'am. Ma'am. I'm sorry for the disturbance, ma'am. With this, the delegates has spoken. Ma'am, please continue, ma'am.
Madam, mute ആണ് ഒന്നും അൺമ്യൂട്ട് ചെയ്ത് പറയുക കേൾക്കുന്നില്ല.
Yes.
Suja madam.
Yes, yes.
Manoj sir is asking something, ma'am.
Sir.
അല്ലല്ല മാഡം പറയുമ്പോൾ മ്യൂട്ട് ആയിരുന്നു, അതെനിക്ക് ചോദിച്ചു.
ഓക്കെ, ഞാൻ പ്രതിഭയോട് സംസാരിച്ചതാ.
ഓക്കെ. അല്ലല്ല ഈ സീനത്ത് മാഡം എന്താ പറയാതെ.
Because I think that there is an interruption with the net connectivity.
അപ്പൊ എന്താ ചെയ്യണേ മാഡം?
So we will start.
Yeah, continue.
Okay. We have with us Dr. A.K. Manoj Kumar, respected registrar, Kerala University of Health Sciences. Sir was with us from the very beginning of the clinical prevention as a patient listener, motivator, and as an efficient guide. May I request you, sir, to felicitate this occasion with your kind words.
Thank you, madam. Honorable Vice Chancellor, Professor, our controller, Dr. Al Kumar, then other Professor Suja ma'am. Sir, sir, connect ആവുന്നുണ്ടോ sir? Sir, mute sir. Mute. Sir, continue sir. Continue.
I don't know where I stopped. I think I was thinking that I was connected and I was continuously talking, and then suddenly Manoj.
Carry your slide and start, ma'am. So much of disturbance, ma'am. Sorry for that, ma'am.
Ma'am, is okay?
Yes, ma'am. Okay, ma'am. Continue, ma'am.
Okay. Actually, can I start from the beginning? Can I start from the beginning, ma'am?
Yes, ma'am.
Hello. The topic assignment is quality initiative in nursing management and administration. This is a program. Actually, nursing management is a totally, when we talk about it, it's a program which deals with the principles and dimension of quality healthcare, patient safety, quality standard of healthcare provider in organization, and implementing the quality improvement program in a healthcare system. So regarding when coming to the quality initiative in nursing management and administration related us, so it is a healthcare in a set of focused activities designed to monitor, analyze, and improve the quality of processor in order to improve the healthcare outcomes in an organization by gathering, analyzing the data in areas of a hospital through which we can effectively implement the change. As a nurse manager, we should take an initiation in the quality initiative to monitor and progress the patient healthcare and patient safety also. So when you want to provide a better nursing quality care, means we should have the good patient care, and also the working atmosphere also should be congenial either for the patient as well as for the working staffs. For that, we should formulate the goals. So what people we are working for it, what is our ultimate goals, what is the expected level of values in providing healthcare to the clients. For that, we should formulate the goals and identify the areas where we need some improvement. For that, we can have the data and we should review the earlier data and analyze the things, which area we are lacking, and evaluate the progress. Is it okay, ma'am? Hello? Hello? Hello?
Slides are not visible. You share the slides.
Yes, ma'am, I have done that. Now it's
share your mobile, ma'am.
Okay.
But yes, ma'am. Yes, ma'am. Open the slide, ma'am. Okay, ma'am.
Okay. Now it is able to see, ma'am? Is it visible?
Yes, ma'am. Yes, ma'am.
Regarding the patient care, improve quality indicators are patient safety survey, error reporting, and record review. As we discussed earlier, we should follow all these things. And also for data reviews, we should have the analytical data for this retrospective event analysis as well as the prospective event analysis. When we do this, we can provide quality care to patients concerned. So as the nurse managers, what are all the responsibilities we have when we look into this? Management of resources and the quiet environment, calm environment, we should find out. And health education, we should educate the service providers as well as patients, relatives, bystanders, everyone. And also the nurse should know the legal responsibility of herself, personal and professional development, ongoing professional development, she should make it. And she should know their ethics and moral responsibilities. And she should work for the improvement. And she has to do activities and proper management, communication, and collaboration with the team. Quality is an optimal balance between the possibilities realized and a framework of norms and values. These are the quality. And what is the quality care? It is when we discuss about the quality care, it is a complete satisfaction of the needs who are in need of healthcare services for the lowest organizational cost and within the given limit. So it must be both beneficial for the either actually patient also should benefited by the less cost, as well as for the organization also should be able to manage with the cost being actually expensed for the patient is concerned. With that or with that limitation, we can able to give a proper quality care. So quality care, why it is very much important? Quality care is very much important because Now we have in the healthcare setting, we have a tougher competition, frequent medical errors, and the raising of cost, as well as raising of demand, concern with the variation in the healthcare outcomes with less cost. These are all the things actually quality care, actually tougher competition, what we are meeting under our own setup. So how can we give a quality healthcare to the patients? Actually, by a nurse, we should be proper in decision making, selection of most appropriate infrastructure, and we should have a perform action. The action should be effective, efficient, and timely approachable. These are all very important. Then each nurse should be much aware of this, and she should follow the activities of the above discussed thing. So when we go for the classification of quality indicators, means we have the 3 quality indicators. One is structure, another one is process, and outcome. The structure, how the institution is being structurally full-fledged, whether the staffs are sufficient, staffs are qualified, staffs are fully actually able to do the processes in a better manner, that comes. And with this only the outcome starts. So the outcome, what we are expecting, the client satisfaction is our outcome. So the managerial quality, we should be, actually the patient should be actually happily goes out of the institution with the full healthy outcome. And then goes for the current approaches in the quality improvement. Quality improvement has nowadays become an administrative mandate than the ethical standard for the nurses. So actually management is concerned, it is more of an administrative mandate. So each nurse should have an administrative skill, and she can monitor, she can manage with the co-workers, with the patients, bystanders, as well as the co-employee, co-professionals. And when we go for the actually better quality management is concerned, we already we discussed earlier, we should be very concerned with patient health, which is very, very important. So with the patient, for the health, patient health, we have to prevent any fall, any injury, and also the pressure source of patients who has been in the bed for a long, and we should go for a pain assessment, physical restraints, and we should have a infection safety policy. So in a patient who has been coming to the hospital and getting the infection from the nosocomial infection, means actually in the managerial system, actually in the hospital environment is not safe for the patient. That we should not actually make it, and we should manage and cut short the infection, as well as we should make the patient feel safety in the hospital. And for the staff, we should have the staff mix. So there must be a patient nurse ratio must be there. There will be a staff strength, means which surely we should not give a proper care to the patients. So the staff mix also will be one of the constraints. So we can come across many hospitals, we can have the qualified staffs, trained staffs, untrained staffs, all will be there. No, that should not be there. Then most of the institution must have especially all the healthcare setting, we must have a trained, qualified, and efficient staffs, and also the staff patient ratio to be maintained. Nursing, and also the nurse should be proper hours to provide the care to the patients. So the nursing care hours is one important factor. Actually, more times we'll have a less care. So when 1 to 7, we can have the 1 to 7, and then actually morning 1, then some of working hours should be specified and make it possible for the client to have a better care. And also the nurses who has been appointed will be in the nurse proper qualified. The education is also much important. If when provide things, when efficiently manage all these things, we can provide a better health care to the patient. And what are the principles involved in the quality? So quality in actually when we are talking about quality initiative, means it is the quality improvement, which is a journey. So it is not only a place, it is a journey. It's an ongoing process of many small steps. So we can have only many small steps only we can make it possible to have a quality improvement. Success is achieved through meeting the needs of the working place and also the way in which we serve to the clients. And most of the problems are found in the process of the system and not with the people. So when we improve the quality of principles of quality, the actions are based upon the accurate and measurable data. So when actually the quality improvement should be based on the how we provide care and accurate and it is measurable. There are 3 types of level of quality in nursing care. Then when we discuss about this acceptable nursing, level 1 acceptable nursing, level 2 actually compatible good nursing, number 3 level is excellent nursing. Number 1 acceptable nursing means all the patients or their care is their routine with the routine plan. Number 2 level 2 comparatively good nursing, nursing is planned but the patient is not directly involved in planning and assessment. Number excellent nursing, number level 3, the nursing is planned and assessed together with the patient and his relatives. The patient is an equal participation in making the nursing process. When we do the 3 tiers, the level of quality in the nursing care will be the maximum. So the causes for the quality healthcare problem is inefficient healthcare system, lack of systematic quality evaluation, and insufficient staffing. Thus, nowadays we are come across, we have insufficient staffing because most of actually we are training a lot of nurses, we are getting enough staff nurses or nurses for patient care. So here there is the insufficient staffing, which means the lack of care. Identify that actually how we can identify whether the quality care is being there or not. We should go for where things are goes wrong, we should assess. How things are goes wrong, we should assess. Why things are go wrong, we should assess. When we identify, when we assess these tools, we can able to give you a better services to the person who was coming to the hospital. When they how come out to the hospital for making them comfortable and make their treatment safely, and also they should have a recovery, be responsible for it, and should identify the tools and we make the tools, utilize the tools and make the patients safety. Then how as a nurse manager, what all the things we should do to the quality improve. So as nurses, as the nurse manager, we can continuously assess the performance status as we discussed earlier and continuously works with the organization managers to ensure the problems. So the nurse frequently discuss with the managers and they should identify the problem and discuss with the manager and get the things done. So they should fix with the training and they make the health most efficient. And get the feedback from the actually beneficiaries, then actually give the feedback getting from the patient. We should provide the feedback to the managers and also the administrators and also the managerial aspects, and we should submit our recommendation to provide quality care and systematic improvement in the policies and the process. As nurse managers, we should make a systematic improve policies, then and there we have to change the policy based on the needs of the clients. We should make the policies and the processes on then and there we should modify. When we go for this kind of systematic evaluation and systematic assessment, systematic improvement, we can make the better care, and these are all the nurse managers, we can make it possible. Thereby we can improve the qualities of a institution. So in approaches, what are all the nurses, how we can approach? We discuss 3 things are there through which we can Sorry, there is an interruption. So approaches for the quality improvement, intelligent healthcare system, quality crossing the chasm, introduce concept of streamlining the processes, produce better outcomes, following rules and protocols. So when we go for a lack of systemic evaluation, we are crossing the quality chasm, providing the financial incentives to how to overcome this means provide financial incentive to do better quality, provide with the benchmark to evaluate the quality care. Insufficient staffing. So insufficient staffing may lead to poor quality care. Higher patient nurse ratio gives negative outcome. So how to overcome this? Educating the public about the nursing, decreasing the patient-nurse ratio. So how safety is a quality indicator through which we can provide a quality care. There are 6 core dimensions of quality. One is safety, effectiveness, patient-centeredness, timeliness, equity, and efficiency. Savage.
Ma'am, PPT page change ஆயிருக்கு ma'am screenல. Slides are visible, ma'am. Just move to the slideshow. Slideshow. Just move to the slideshow option. Mr. Ilango, who has shared the screen, no? Slides are moving, you keep in the slideshow option.
Sorry for the interruption.
Just the slideshow option, ma'am. FI option. FI option. Yes, ma'am. Yes, ma'am.
Now it's okay,
Now it's
no?
okay, ma'am. Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
So now, actually from the year 1990, the quality health issues have come, and it is being a great concern for each healthcare setting here. And there are various reports have come, and which includes people should have a proper quality managers must be there, and the infection control policy to be laid over, and the infection control nurses being appointed. All these things we need to have a better quality. So as a nurse manager, what we can do is continuously assess the performance data and trends, continuously works with the organization managers to ensure the problem of healthcare are identified and fixed, helps design and execute training programs, provides feedback and recommendations, systematic improvement in policies and process, as I discussed very earlier. So regarding the approaches for quality initiative or quality improvement, we should have three things: inefficient healthcare system, lack of systematic evaluation, and insufficient staffing. So insufficient staffing is one of the most important things, which is poor quality care, higher patients ratio, and also actually the education towards that nursing care client is very less. For that, we can improve the quality is by introduce concept of quality streamlining and process to produce better outcomes, forming rules and protocols, provide financial incentive to do better quality, and provide benchmark to evaluate the quality care. So educating the public about the nursing, decreasing the patient nurse ratio.
ऐसे दिग्गज पढ़े हैं भाई साहब साउथ में तो
Safety as a quality indicator. There are 6 core dimensions for quality. Number 1 is safety, effectiveness, patient-centeredness, timeliness, equity, and efficiency. These are all the 6 core dimensions to improve the quality, which can be framed as a quality indicator of any healthcare institutions. And one more important thing is, when there is a lack of patient-nurse ratio, it have a actually produce stress on the health personnel, which is one of the challenges in giving quality care. So when we assess the quality, actually what all the causes for stress means job insecurity, high performance demand, bad boss, workplace culture, personal or family problems, and technology. All these are the important which we can expect any healthcare setting, the individual will be suffering, and the stress to be overcome by the management through which we can improve the work efficiency. And when we come into the stress level, so low stress level will then actually will coming into the picture. So low stress level, medium stress level, high stress level. So low stress level, the patient actually, the staff will be actually more alert and they will go for maximum optimal level. When the stress increases, they have anxiety, disorganization, and the work efficiency will get reduced. So as a managers, we should assess the stress level of the staffs and the level of the working atmosphere, and we should make it rectify and get it corrected and make the staffs be happy to render their fullest services in the healthcare settings. Then actually when we have the positive stress result, when we does all things is in a better manner, and when they able to do all these things, we can able to have a positive stress result, which a positive stress result will give you, enables actually the healthcare workers will be enabled more, they will provide more concentration, and which increases their work performance and energizes you into the higher motion. So we have to have a stress reduction. So be aware of your choices. You always have a choice. So when actually management or when the actually managers are imposing you to do a huge actually lot of works, means you should actually in a position to have choices. Then choice, opting the choice only reduces the stress. And also learn to say no. You can't do all the works and everything you have been asked. So better you actually any managers or health personnel, and then they should assess their ability and their working timings and their work stress, everything they assess, and they can able to say no when they have been asked to do some extra works. Do actually when you have stress, what is the management? Do nothing, which is not at all possible, but all that we should say, do nothing. That is right. That makes you close the door, open the window, have a seat, and take a little break from life. If your mind is racing, learn to meditate and just let that stress go. How many of you it is possible for them to do that? So in the working atmosphere, it is not possible for us. We should make our environment in a congenial manner by keeping a few minutes to have the stress to overcome. And listening to music, also music therapy, which also elevate the stress to some extent. So we should have the habit of listening music, which will stress relief. Then we should follow the ABC strategy. We should have the awareness, we should have the balance, and we should have the control. How to have the stress reduction? We should have the awareness, we should maintain the balance, and we should have the control. So either in the day or in the night, we should have the maintain the ABC strategy. Then after having the stress, and one more important actually thing, because all the healthcare personnel will face the thing is conflict. So the conflict management is also one of the important factors through which we can improve the work performance. The management of conflicts comes under actually the managers or the administrators to identify where the sources, from where they are getting the conflicts and what kind of types of conflicts. So from the actually we can get into three categories. The sources of the conflicts can occur through the different cultures. People from different areas, they come and join over here, and they have a different cultural conflicts. Then different perception. So they may think about something differently, and they have a different perception conflicts also will be there. Defining the problem differently. So the managers will say something, the people will perceive something, and also they have the problem with the actually defining the problem different way. So and next one is the interpersonal group conflicts, and then intergroup organizational conflict. These are the basis for the conflicts. Then how the conflicts can be managed. Avoiding the actually conflicts, accommodating in a better manner, compromising and collaborating and competing the conflict will make any person to come in a successful manner. So through that, the conflict will make the work performance low. So we should overcome the conflict, and we can compete with the conflict, and we have to put our fullest effort in healthcare providing system. And how we can, what are all the resolutions? So there are three resolutions: win, lose, win, win. In three aspects. Any health personnel comes in this three category: win, loss, win. So win, loss, the position, power, mental and physical power, failure to respond. Failure to respond, majority rule railroading, competing. So here one part is winning, another part is losing. So in that lose, they compromise everything. So they compromise, they go for price and they go for arbitration. Then the general rule makes the improvement. Win-win. So how we can have that? So any nurse manager, any nurse administrator, any nurse professional should have the thing as win-win actually level we should go for. So this is the problem solving, consensus problem solving, and we should within all the department will makes us the conflict get into resolved. Another important factor which most of the health personnel is lacking is decision making. So decision making is an important tool in which we can have the better healthcare. So what all the actually important tool when we discuss means identify the problem, which is most important, where the problem is. So how we can actually analyze the situation and try to solve the problems through critical thinking and create your decision making. So what to do, what not to do in that situation, we have to decide, and which should not actually overcome with the ethical aspects. So the decision making is an important role to provide the actually good and quality care in the management level as well as in the administrative level. There are a lot of ways and means are there to management. But we have actually we can concise all these things. We can have the 14 steps to have improvement. One is commitment. So the commitment is the first and foremost important thing, either from the management side or from the worker side. All sources we should have the proper committed. What the work given to you, you should come here actually very committedly. People can work means we can have the quality. Then use of quality improvement teams composed of people with the processes, knowledge, and the commitment to actions. So the identification of person which we have the actually knowledge, commitment to action is most important. So in that, when we use them in the actually as a team members for a quality, surely it is possible. And next one is quality measurement. So actually we should have the follow framework protocols. So quality measurements which will identify the areas of need for periodical. Already we mentioned about the retrospective and the prospective study through which we through the study we can identify which area needs to get the improvement and we need to have the change. Then next one is measuring the cost of quality and non-quality. So we are actually nurse managers should measure the cost. With the low cost, better quality is being needed by all the institutions as well as anyone. So we should measure the cost quality and non-quality. And quality awareness by all persons. If all should have the idea, all should have the knowledge about by providing quality health care. So all the health personnel should be aware of health quality awareness. Then corrective actions through opportunities for improvement. So give opportunity to all the people. So when through them, through their opportunity only, we can identify who are all capable of doing quality care, through which we can identify and form a team to improve the qualities. So zero defect planning. So we should not have, we not should give a room for actually defects. So do the right in the first time itself. Should do the right things. And employee education, that is for most important education, then actually periodical the later trends, everything has actually teach them and make the students up. Education to have a zero defect demonstration of a commitment to quality. So zero defect day. So when we have a zero defect day demonstration, which gives you a commitment to quality. Then goal setting, as we discussed, the goal setting, when we have a goal, our goal should be zero defect. Then actually through which we can casual removal by removing the barriers. So we identify the barriers who are being barriers for doing the better things, remove all the barriers and recognizing recognition for meeting goals. For all meeting the goals in the low cost manner, people has to recognize, and some incentive policy also will make the quality improvement. Quality council to assist people in quality. So we should form the quality council. So once in a way we have to arrange for the quality council's meeting through which we can improve the quality of any institution. Do actually all the 14 steps to be repeated regularly, periodically, through which we can actually get a better care, quality care, and actually which we needed to all the wherever you go, you needed to have a quality. So through this 14 steps, nurse manager, nurse administrator can make it possible to have a better quality and actually quality care and quality improvement. So through this, I can finish it off my session. I thank all the VMACON mission and actually College of Nursing has given me this opportunity to share of my few ideas to you and also make how to have a quality nurses, quality care to the patient, quality initiative in the administrative setup, everything through this repeat only we can make it possible. So through this, we can actually make it lack of systematic quality education to get evaluation to get it improved, and we should improve the systematic quality evaluation, which is mandatory, and also insufficient staffing also get to be get relieved through by frequent and periodic evaluation. We will assess and we implement accordingly, then we can have a safe setup, healthcare setup in our hospital, in our college, wherever we actually nurses are being there, we should have adequate staffing pattern, which will help on all aspects. in a holistic manner. I thank you all for giving me the opportunity. If anyone have any doubts, can will ask me. I'm ready to in a position to clear your doubts. Thank you one and all. Thank you.
Thank you, ma'am, for your crystal clear presentation. You have told how to maintain the quality initiatives and how to overcome the stress and conflict during the administration. It's a very, very important scenario nowadays. Stress and conflict to be resolved, then only we can get the proper outcome. Thank you so much, ma'am, for your wonderful presentation today. Thank you, ma'am.
Thank you. Thank you. Thank you.
Next, we will move on to the second session of today. Dear participant, you post your queries in the chat box. We will be answered in the end of this second session. We are in the day 1, second session and last session of today. The next session is the topic on performance appraisal system, a quality tool. It will be dealt by the Swamivel Seduraman, graduate registered nurse, Hammond Mental Health Hospital, Qatar. Has completed her BSc Nursing, VMACON Annapurna College of Nursing, in the year of 2004 under the Dr. MGR Medical University, and completed his MSc Nursing in the field of Psychiatry Nursing in the year of 2009, JSS College of Nursing, Mysore, under the Rajiv Gandhi University of Health Sciences. Has completed CNP, that is Colombo University 2013, Manasa Distance Education Foundation for Mental Health, Coimbatore University. PhD in Psychiatry Nursing Scholar 2006 in Himalayan University, Arunachal Pradesh, India. She has done that PG DCPT 2020, Institute of Holistic Mental Health, Tamil Nadu, India. Has so much of working experiences. In the year 2004 to 7 as a registered nurse, Gopala Gowda, Sandavari Memorial Hospital, Mysore. 2009 to 13 as a lecturer in Gobalagowda Sandavari Memorial Hospital, Mysore. 2014 and 2018 as a registered nurse in the field of psychiatric nursing, Gobalagowda Sandavari Memorial Hospital, Mysore. In the year of 2018, graduate registered nurse in that hospital is Hammond Mental Health Hospital, Qatar. We are very much pleasure to welcome you, sir, to present your session. Slides are visible. You can start the session, sir.
ये लिए पर 3-4 दिन का। हाँ 4 दिन का है। कर रखा है पर लिंक क्यों नहीं आई तो सर इसकी।
Swami Ven, you can start the session. And check your audio.
System laptop down.
அது கரெக்டா படிச்சு இது கரெக்டா வந்துச்சு முதல்ல வந்து சிஸ்டத்தை வாங்கி இருந்திருக்கலாமோ. ஓகே, தேங்க்யூ.
இப்ப பாருங்க, கேக்குதுங்களா? கேக்குதா? ஓகே, ஐ வில் கம், ஐ வில் கனெக்ட் now. I will connect. Okay, thank you. Thank you.
Now audible, we can start this sharing.
Hello, madam. Good morning. Hello, ma'am. Good morning.
Good morning. Good morning, Swanvi.
Am I audible?
Audible only. Audible only.
Okay, madam. Oh, so the screen is visible, ma'am? My screen?
Yes, yes, visible, clear.
Okay. So I'll start my session, ma'am. A warm good morning to respected principal, Dr. Maheshwari, vice principal, teachers, and my dear students. I hope you all are doing good. As you know, after completion of our basic educational training program, some candidates prefer to work in a hospital setting. Some candidates prefer to work in an educational institutional setup. Okay. However, all the candidates, we all work towards to achieve the goal. So they all work throughout the year under this supervision. This supervision will not be completed without evaluation. So every individuals or the employees in the organizations are supposed to be evaluated in the name of performance appraisal to know about their strength and weakness. So today we are going to discuss about performance appraisal system. All you got it? Okay. So today's my topic is performance appraisal system. Today in the morning first session, in detail, Madam, the expert, Dr. Bechiamal explained in detail about the quality initiatives in nursing management and administration. Continuing that, my topic is performance appraisal system. Now we are going to discuss about in a hospital setup as well as briefly I'm going to just list out the methods of appraisal system in the educational institutions. Okay. So the objectives, educational objectives for my topic. At the end of the session, students will be able to define performance appraisal system, list out the purpose of performance appraisal system, describe the steps in appraisal process, enumerate the principles and components of performance appraisal, explain about the methods of appraisals in the hospital, mainly briefly about an educational institutions, list out the leadership roles associated with the performance appraisal. Last one, recommendations for conducting performance appraisal. So keeping those objectives in our mind, let us move to next slide. Okay, so as I told you, what is performance appraisal? Performance appraisal means all the employees' behavior in the hospital setup or educational institution. What is that behavior? It's the overall behavior in the aspect of, like, you know, in our hospital, every hospital or educational institutions, they evaluate the employees' performance. Okay, the overall behavior. What are all those behavior? See, every hospital at the same time organization, they have their own evaluation form in a different unit-wise, different settings. Okay, I will tell you some of the components. What, you know, in our hospital setup, in which way, you know, we are being evaluated. There are 5 components: professional and ethical practice, clinical practice, leadership and management, education, learning and development. Last one, research and improvement. So these are all the 5 dimensions, or all the employees are evaluated, especially nurses. Okay, 5 dimensions. So what is performance evaluation? This is a desired result of any employee's behavior is effective job performance. Okay, so these 5 components are, you know, keeping in our mind. The supervisor is going to evaluate all the employees in a hospital setup. Okay, So performance related behaviors are directly associated with the job task and need to be accomplished to achieve a job objectives. Okay. The beginning. So when we join the organization or the unit, give job description for the nurses and the candidate who is joining into the educational institution for the various posts. Okay. For example, clinical inspector, assistant lecturer, and so on, based on their educational background. So they get job. So once if they join, they get job description. So following the job description standard and the mission of the organization, we have to work. So that is going to be evaluated. Here, a hospital administrator has to have information regarding the performance of all the personnel working in the hospital, except for the few top administrative officers. Okay. So the administrator or the supervisor, usually the head nurse in the unit or the principal in the educational institutions, they are the supervisors are going to evaluate their subordinates, employees. So what is performance appraisal? Performance appraisal is the evaluation of work done during a specific time period against the background of the total working situation. Okay. The performance appraisal is the evaluation of work done during a specified time period against the background of the total working situation. So the task, the responsibility, job responsibilities, like the quality of work, the quantity of work, and the manner it is carried out. The manner it is carried out. As I said, there are 5 dimensions. The job responsibilities are carried out in a hospital setting. In our hospital, I told you the 5-dimensional. First one, professional and ethical practice. The nurse is carrying out the responsibilities in a professional manner and following the ethical practice. And the clinical practice, the clinical competencies, the procedures or the work task in the bedside, the communication with the patient, the personality of the candidates or the nurse. Then leadership and management, how the nurse is showing the leadership role towards their colleagues and their subordinates. Fourth one, education, learning and development. I told you educational development. While working, how the nurse is updating his or her knowledge by attending a CNS program. Okay. Continuing learning development program. And research and improvement. Okay, the nurse, how effectively involving in identifying the research problem and how he or she is carrying out the research work in the working situation. So that is going to be evaluated in the aspect of quality, quantity, and the manner it is carried out. Another definition, performance appraisal is the planning and record of certain personality and behavioral characteristics of individual, effectiveness at the job, and contribution to the achievement of organizational goal. Okay, this is another definition. Okay, there are many definitions for the performance appraisal. Okay, some definition giving clear cut meaning. So behavioral characteristics of the individual. Behavioral characteristics. What is behavioral characteristics? We have many job responsibilities. At the same time, behavioral characteristics means the job description or the task, how it is being carried out, how we are punctual to the duties, how we are looking our personality, the way we communicate, the how punctually we are finishing our task. See, when we enter into the duty, take over the responsibility and carrying out the responsibility, how effectively completing the responsibility until end of the shift. Next, we need to hand over in a written document. At the same time, verbally we have to communicate what we have done, what is to be carried out for the next step. Okay, so these are all the behaviors of the nurse. So the effectiveness at the job and the contribution to the achievement of the organizational goal, how effectively and we take responsibility to achieve the organizational goal. Okay, so this is called the performance appraisal. Next, let us move on to the purpose of performance appraisal. Okay. Purpose. Very easy to understand this. Purpose of performance. It is been evaluated. First one, the employee performance. to know about the employee's performance. Okay, once, for example, the supervisor or the head nurse or the principal, once when we get appointment as a nurse or as a clinical instructor or lecturer in the educational setup, okay, after appointment, the job description is given to the candidate. Okay, the how the candidate is carrying out the job or the responsibilities. Okay, how effectively, qualitatively, and quantitatively with evidence based, how he or she is performing in the unit or in the educational setup, that is to be evaluated. Next, employee development. Okay, the organizational development. To what extent the organization development has been happened, what we planned, to what extent we achieved in order to the development of the organization. Okay, next one, supervisory understand. Okay, so as a head nurse or the principal need to understand about their subordinate, to what extent the staff is working, what the staff knows and what he or she don't know. Okay, to understand about the strength and weakness of the staff, the supervisor supposed to evaluate the subordinates or their employees. Fourth one, guide to job change. Okay, this evaluation helps for the head nurse or the supervisor for to guide job change. For example, all the candidates work in different aspect. Okay, different dimensions, but this evaluation will help for the supervisor to to what extent the candidate is performing, whether he or need changing in the job, because some may perform very effectively, some may not be able to perform very effectively. The skill to perform in a bedside or the skill to perform in a classroom setting, the method of teaching, way of handling the students, okay, this need to be analyzed properly in order to retain the staff or to change the staff or to promote or to increase the salary or to demote the candidates. For all these things, this evaluation helps for the supervisors to understand about their subordinates. Next, salary and wage administration. As I said clearly, this evaluation helps for the supervisor to fix the salary or to for the to give incentives or to hike the salary. Okay, to we can analyze by evaluating all these things, we can analyze and we can supervisor will have an idea to fix the salary or to give hike the salaries. Next, coaching and counseling. What do you mean coaching and counseling? Okay, so the supervisor, once when we evaluate, we come to know that as a supervisor, a head nurse, or the principal, we can identify the strength and weakness of our employee. Okay, where the staff is performing, showing excellence in their task or delegating the task or carrying out the task and responsibilities, and we can give proper guidance and counseling. If the staff is not performing properly, we can call them, what is the what is hindering them or what is not helping for them to practicing in a professional way. So we can identify the weakness and strength for helping the staff to retain or to promote a teamwork. Okay, next, remaining dissatisfaction. Okay, this evaluation helps the supervisor to identify the dissatisfaction among the staff. We have many employees, very many staffs. Some staffs are not satisfied in many aspects. For example, higher qualified people may be in a low position, or low qualified people may be in a high position, or some staffs may have knowledge and may not be able to invest their knowledge. Sometimes there may be a lot of lacking, like men, money, material. Some very well, India's developing country may not be able to appoint the right number of person, money and material, men, money, material. There may not be adequate men, money, material. When there is no men, money, material in the organization, and it definitely cannot be able to deliver the quality of work, or unable to achieve the organizational goal. So it helps for the supervisors to identify the talented staff and what is hindering them to to invest their knowledge in a different aspect. Okay, then this performance evaluation is helping for the supervisor for validating the personal program. Okay, So after evaluating, this will help for the supervisor for validating the, okay, next, this staff have this much knowledge or talent. This staff have, this weakness. This, by validating their performance, their strength and weakness, their all the qualities, we can plan further in which area they need coaching, training, counseling, or where we need to appoint them, their interest or their dissatisfaction. All these things can be identified and they can be appointed in a right place. Okay, these are all the purpose. Okay, there are total 8 purpose, and there are many other purpose also we can discuss to determine the job competencies and to enhance the staff development, discover employees' aspirations. It helps for the supervisor to recognize the accomplishment, what the accomplishment of, to what extent the goal has been achieved by the employees. Then it helps for the improve communication. We can help the subordinate to improve the communication. Then aid in coaching, counseling, make inventories of talent, then identify the unsatisfactory employees in both setting, hospital and the educational institutions. Next, let us move on to appraisal process. Okay, appraisal process. So what is the appraisal process? So for every task, there must be some protocol, some process. Okay, here to evaluate these subordinates or employees, there is some process. What is that process? Let us, we are going to discuss now. First one, to set standard based on the job analysis. First, we have to set standard. What is that set standard? For example, say hospital, different bodies, general bodies or the standard bodies. For example, for a hospital, we know National Accreditation Board for hospitals and JCI, Joint Commission, International Accreditation for the healthcare workers. These are all the this is example for the bodies which give standard for the hospital. The infrastructure, money, material, how to allocate. All the standard is been given by the NIBH and JCI standard. Okay, they have their own standard. At the same time, if you take the educational institution, school, college, for the various program, GNM, BSN, MSN, and PhD program, MPhil program, and so many other programs, State Nursing Council, Indian Nursing Council, and the Tamil Nadu state government, they have their own set of standard to start school, to run a GNM program, BSN program, MSN program, PhD program. These are all the standard. If you have this standard, then the permission will be granted to run a school, college, or different program. At the same time, when you appoint employee for different levels of grade, every job has its own job description. Okay, this job description, there are standard job description given by the government. At the same time, institutional based job description, and they have their own standard for evaluating their employees. Okay, first we have to set standard, then communicate the standard of job performance. Okay, after setting standard, this is the way job description, this is what the duties and task responsibilities, it has to be communicated with the employee once when they get appointed. Okay, not only at the time of appointment, frequently it has to be reminded, and as a continuing staff development. Okay, educational development, we have to give remaining programs. Okay, learning programs. Then measure performance. Okay, set standard, then it has been communicated to the employee, then measure the performance, select appropriate tool to evaluate the educational, the teachers for the various categories. At the same time, in a hospital setup, for example, various levels of grade, staff nurse, charge nurse, head nurse, then clinical nursing specialist. Okay, clinical nurse specialist, and there are many other specialty nurses. For every job, every grade, they have different standard, and tools are used to evaluate the employees. Next one, compare performance standard. Okay, all the employees know what they need to do. What is their responsibilities? We have tool in our hand. Okay. At the end of the year, we have to be evaluate all the employees. Got it? We have to compare what standard we have, what the performance has been done by the employee. It has to be compared. Rate the employee performance. Okay, the supervisor, head nurse, or the principal, once if they evaluated, we have to rate the employee. For example, 25%, 30%, 36%, 42%. Some may perform to the 80%, 90%. Okay. The evaluators or supervisor has to rate the employee's performance. Then this rating has to be communicated with the employees. They should know, all the candidates or employees should know about their rating, to where they are standing. They should know. Okay. For example, bad, average, good, very good, excellence, perfectionism. So like this, we can classify and rate the employee about their performance. Last one, use the appraisal for decision making and developmental process. As I said earlier, this evaluation has to be, it helps for the supervisor for decision making, to retain the staff, to promote the staff, to hike the salary, or to give any sort of punishment or training, coaching, counseling, and in order to achieve the unit goals and key performance indicator. Every year, the key performance indicator in the unit, the organizational goal, departmental goal has to be achieved. If not achieved, to achieve, what can be done, what is lacking, how we can achieve. Okay, it helps for the supervisor to identify the area where to develop. Okay, how to develop, what we have to do. Okay, so this one helps. Okay, so this is the appraisal process. Okay, there are 7 steps in the appraisal process. Next, let us move on to the principles. Nurse's evaluation should be based on behaviorally oriented performance standard for the position that she occupies. Okay, as I said, behaviorally, the task, I said, 5 dimensions, like I keep reminding you why, we have to be thorough about these dimensions. Professional and ethical practice, clinical practice, leadership and management, education, learning and development, research and improvement. These 5 dimensional, how a nurse or the clinical instructor is carrying out, while performing their tasks and responsibilities. Adequate and representative sample of the individual behavior should be observed in evaluating her performance. Okay, adequate representative sample of the individual's behavior. As I said, representative sample, that means employees behavior. For example, some employees, their thoughts, innovative ideas, creative ideas, we can identify, very easily. Okay, for example, the staff may, all have to maintain their own portfolios, and by in different activities, coming up with updating our educational programs, CNE continuing nursing development programs, updating educational unit-wise educational program. Okay, so like that, and research ideas, all these, individuals' behavior. The individuals should be given a copy of job description format standard and the evaluation form. Okay, we have to give in advance before evaluating the candidate. Okay. Then 4th principles, in documentary employees performance appraisal, the supervisor should indicate this area in which performance is satisfactory and these in which improvement are needed. Okay, so 4th principle, we as a supervisor, we have to documentary employees performance. We have to document, for example, monthly evaluation, quarterly evaluation, and half yearly evaluation or yearly evaluation. Periodical evaluation supposed to be done by the supervisor, and it has to be filed it properly and keep it safely. Okay, and it has to be communicated with the employee in which area they are satisfied and which area not satisfied, where they need improvement. Okay, we have to tell in advance to all the employees. Then if we want the improvement in several areas, then specify which area need to be given priority. Okay, the evaluation conference should be scheduled at a time convenient for both the employee and the supervisor. We have to give it, proper time and place for evaluating the employee. Okay, these are all the principles. I think I'm very slow. Let me go a little fast. Next, we are going to discuss about the component to be evaluated. Nurses engage in a variety of job-related activities. To reflect the multidimensional nature of the job, the performance appraisal form usually requires a nurse manager to rate several different performance dimensionals such as use of the nursing process, professionalism, safety, continuing education, and initiatives. Okay, these are all the dimensions, multi-dimensional area. As I said earlier, these 5 dimensions, like how the nurse is carrying out the nursing process. Okay, once the handing over taken by the nurse, how the nurse is planning the care for the patient. Okay, we all might be familiar about the nursing process, I hope. Okay, identify the problem, objective problem and subjective problem, then make a diagnosis, the assessment, make a goal, then plan the nursing intervention, implement it in a time, and then evaluate the goal or the whatever the procedure done by the nurse. Then professionalism, how professionally and by following the ethical practice. Okay, by giving all the ethical practice or keeping all the dimensions in our mind, how she is carrying out the responsibility. And safety, how safely the nurse is working in the unit for the patient. Okay, how safety for the patient and safety for the healthcare team members. Then continuing education, how the nurse is updating their knowledge while working. Okay, then initiatives in a different aspect. Okay, these are all the multi-dimensional area the nurse are supposed to be evaluated. Okay, component to be evaluated. First one, trait and personal characteristics. Many appraisal systems focus on personal traits and characteristics such as the ability or stability to handle the stress. Okay, we know the nursing environment is a very stressful environment. Those who have experience, I hope you can understand very easily. The nurse job is not so easy. At that time, we have to handle many dimensional, many area to manage the patient care. Okay, we have to the patient stress, and the family members, they may come and ask something. Doctors, the multidisciplinary team members, doctors will put order something, case manager will communicate something, and the charge nurse, head nurse, all we are responsible, a very stressful environment. Okay, this trait and the personal characteristics. So nurse supposed to keep it in mind, the personal characteristics by following all the dimensions in our mind. We have to do our job by proper planning and implementation. Then result-oriented system. All the organization, even non-profit healthcare organizations, need to be concerned with a bottom line. Okay, need to be concerned with a bottom line. For example, you just imagine if the hospital has a 35% occupancy rate or 20% employees absenteeism rate, its future is in jeopardy. That means the organization, for example, less than 35% occupancy or less than 20% of the employees are keep absenteeism in the organization. That means, the organization is going to fail or unable to achieve the goal, or they are going to close. Okay, so the result-oriented system. So the component. Okay, all the organization result is very important. In an educational institution, then principal need 100% pass. All the students get pass with a distinction. Okay, the class teacher, coordinator expect all the students to get pass. Okay, so result-oriented system, we have to keep it in our mind. Okay, first one I told you, trait and personal characteristics of the teachers and nurses. Next, result-oriented system, we need 100% pass and with a distinction. Okay, so in case if there is a very, very, very low performance by the students or low occupancy in the hospital because of if they may not run properly, in that case what will happen? They may fail in their life, or they have to close the organization. Then component to be evaluated, behavioral criteria. Then behavior oriented system focus on what the employees actually does, such as system gives new employees specific information on how they are expected to behave and is less likely to lead legal problems. The behavioral focus facilitates employees development. Okay, as I told you very clearly, such a system gives new employees specific information on how they are expected to behave. Okay. Behavioral criteria. I told you all the dimensions keep in our mind. We have to, work. We have to be very, responsible, carry out the responsibility, finish our task in time, and it must be communicated in a written way or communicate to the next shift staff nurse what is being done and what it is not done, what need to be carried out. Okay. That will help for the nurse to be away from the legal problems. Okay, if we don't communicate the things properly in a working environment, what will happen? We will be, we will have to, face many legal problems. Okay, punishment or salary cut or some sort of demotions, many things will happen. So the behavioral focus facilitates employee development. Okay, the behavior is very, very important for both nurse or, teacher, everyone. Behavioral aspect, very, very important. Next component to be evaluated, combining different criteria. Okay, in such a system, each employee may have a few major objectives he or she is expected to accomplish. So apart from the defined job description, everyone in their level, they have some major objectives. He or she has to, be little bit advanced in their role. Okay. Okay, these are all the components to be evaluated. Next, several techniques exist for appraisal of employees in an organization. Each has its own combination of strength and weakness. Okay, several techniques, and no one technique by itself is able to achieve all the purpose for which management institutes the appraisal program. Okay, the choice of a particular technology depends on three major factors. What are all those factors? Let us move. First one, utilitarian criteria. Why is performance evaluation being done? The objective may be for a disciplinary action, feedback for employee development, promotion, selection, or a training. I told you the utilization criteria. We have discussed in detail. Then qualitative criteria, consideration of an organizational constraints, assumptions of the method, relevance of evaluation criteria, data availability, practicality, and potential for equivalence. Then last one, interpretability. So format. Okay, all these qualities are supposed to be included. Okay, first one, utilization criteria. Next one, qualitative criteria. Last one, quantitative criteria. A technique which is potentially less subjective and more objective than another is to preferred. Okay, objective is the ability of the format to bring out impartial, reliable, and valid information about the individual. Okay, so include all these criteria and components while preparing or while evaluating the staff or employees. Okay, now we are going to discuss the important part of the session. First, there are methods of appraisal. Okay, what methods are going to use to evaluate the employees in our hospital setting and in educational institutions? Okay, first one, self-appraisal. What do you mean self-appraisal? It means employees are increasingly being asked to submit written summaries or portfolios of their work-related accomplishment and productivity as part of the self-appraisal process. Okay, the year beginning, all the employees in the organization, okay, are instructed very clearly whatever the achievement or the task responsibility when you're carrying out, we need evidence-based. Okay, evidence-based. For example, when you plan for a health education, okay, individual health education or group health education, okay, and activities for the patient or the procedure competencies, what the care you deliver to the patient, the way you communicate, the all the research activities, updating your continuing nursing education program, all these things, we need to submit the portfolio. We have to maintain our own portfolios. That is the evidence for the employees to prove that what the accomplishment they have done during the year. Next one, portfolios often provide examples of how the employees has implemented clinical guidelines, patient outcomes achieved, and sample patient care documentation, everything. As I said, the portfolio also generally includes the employee's goal and an action plan for accomplishment of all these goals. Okay, the portfolio, the files are maintained for all the students at the same time in a hospital setup. All the employees, including doctors, nurses, for everyone, they maintain portfolio. We maintain portfolio of our achievements, the task which is being carried out. Next one, appraisal by others, rating on appraisal by supervisor. The supervisor, rating already we discussed. The supervisor rating the employees in a different. There are different way. The tools, graphic rating scale, rating scale, simple rating scale, then forced distribution system, free writer, essay. So these techniques are rarely used in a hospital setting. Okay, let us see what is next one. Forced choice appraisal. In this, there are sub classifications are there. Critical incident method, field review techniques, rating by self and by groups, feedback of appraisal information, appraisal using performance statistics, other methods like MBO, management by objectives. These are all the techniques or methods tools are being used to evaluate the employees in a different setting. Next one, the technology of appraisal. Since the 1920, many appraisal tools have been developed. Certain types of tools or renewed techniques have been popular at different times. Joint Commission on Accreditation of Healthcare Organizations advocating the use of employees for this appraisal. Okay, the joint JCI, they have given their own standard for the hospitals to maintain the standard of delivering and updating the care. Then traditional rating scale. In that traditional rating scale, many organizations use a traditional rating scale for all the employees in a class. For example, nurse, clinical nurse, regardless of specific job setting, in a different department, ambulatory, emergency nurse, outpatient, OPD, ICU, MICU, like psychiatric department or medicine department, various department. Every department has their own way of evaluation. They have this a traditional rating scale. All the department, they evaluate in a by keeping the same components. That is called the traditional rating scale. That means olden days, ancient time, there are many years they are following this technique. Traditional rating scale includes like a general performance, equally weighted dimensions. As I said, like different dimensions, like what is that? Professional and ethical practice, clinical practice, leadership and management, educational learning and development, research and improvement. Okay, keeping these dimensions equally weighted dimensions. Okay,
ஒரு நாலேஜ் காம்பனன்ட்டே அந்த காக்னிஷனே ரைஸ் ஆகல. திரும்ப வந்து எக்ஸாம் பிஃபோர் நாங்க
Okay, forced distribution evaluation, obsolete system standard, judgment based on supervisor's idea. In filling out a traditional rating scale, the appraiser is required to reflect on the appraisee performance over the entire evaluation period. I told the whole year. The supervisor observes all the employees, and the teacher principal observes the teachers performance throughout the year in a different dimensions, and finally they evaluate the end of the year. This month, actually we have evaluation. Actually, this December, end of this month, we have evaluation, annual performance evaluation. We have to go for the interview. Okay, then trait rating scale. What do you mean trait rating scale? That means trait means certain characteristics. Okay, certain characteristics based on observing certain characteristics. The supervisor is going to evaluate the employees. A rating scale is a method of rating a person against a set standard, which may be the job description, desired behavior, or personal traits. The rating scale is probably the most widely used of available appraisal method. Rating appraisal. Rating personal trait and behavior is the oldest type of rating scale. As I said, it is a trait. Trait means it is certain characteristics. By observing certain characteristics of each employees are going to be evaluated. This method is being widely used since many years in many organizations. Okay. Next one is checklist. This is the most common measurement tool is been used in all, either in a hospital setup or in educational institutional setup. We use checklist to evaluate the employees. There are several types of checklist appraisal tools like a weighted scale, forced checklist, then simple checklist. Weighted scale, forced checklist, simple checklist. What is weighted scale? It is most frequently used checklist is composed of many behavioral statements that represent desirable job behaviors. Okay, by keeping it is set of desirable behavior. Okay, it's like a behavioral statement. It is most frequently used checklist is composed of many behavioral statements that represent desirable job behaviors. Each of these behavior statement has a weighted score attached to it. You might have gone through like 5-point rating scale, 3-point rating scale, like that. Scale is available to evaluate the employees. Employee receives an overall performance appraisal scores based on their behavior. Okay, based on their behavior, how they are carrying out their responsibilities, attributes, certain characteristics are being evaluated. Next one, forced checklist. Forced checklist means it requires that the supervisor select an undesirable and a desirable behavior for each employee. Both desirable and undesirable behavior has quantitative values, and the employee again end up with a total score on which certain employment decisions are made. Okay, the supervisor uses the forced checklist. In this checklist have desirable behavior and undesirable behavior. So the whole year, after observing, the evaluator or supervisor will take what is desirable and what the undesirable behavior the employee is been exhibiting or performing or showing. Okay, then finally each behavior have its own score. Okay, that will be communicated to the employees. Then simple checklist, you might have seen many checklists. Simple checklist, it is composed of numerous words or phrases describing various employee behavior or traits. These descriptors are often clustered to represent different aspects of one dimension of behavior, such as assertiveness or interpersonal skills. Okay, different checklists are available. In that, one checklist is simple checklist that you can go through in your textbook or the Google. Here I have very less time, since I couldn't show all the type of checklist here. Otherwise, I have various checklists to so for how it can be used to evaluate the employees. Next one is essay type. Okay, essay type of measurement tool. Okay, what is essay? Essay appraisal method is often referred to as the free from review. The employee, the appraiser describes in narrative form an employee's strength and the areas where improvement or growth is needed. Okay, throughout the year, the supervisor or the principal will observe frequently by their performance, and they the principal or the supervisor write essay. It is a description. Okay, maybe 2 or 3 pages they write about the employees behavior, strength and areas to be improved. Next one is peer review. What is peer review? Peer review means our own colleagues. The supervisor will be so they will analyze, they will evaluate about one candidate by asking about our performance from our colleagues. Okay, our own colleagues, they ask indirectly how he or she perform the duties or carrying out the responsibility, how she is updating the knowledge, helping others professionally, punctuality, sincerity, taking responsibility, maintaining safety for the patient, safety for the students, and completing the task in time. All the things are evaluated through the asking questions from the colleagues. Okay, performance appraisal review, interview. The last one method is interview. This method are widely used in many settings. In performance appraisal interview, the nurse manager establish that the performance has been then narrated reward will be documented. Okay, so the interview means the picture, the interviewer and the employees are evaluated by doing interview. Okay, what the difficulties you faced and what the achievement you have done, and all the by keeping all portfolios and their like desirable behavior, undesirable behavior, all the things are discussed in this interview, and finally the score will or rating will be done by the supervisor to the employee, and that is been communicated. Based on that, the score the staff will be retained or promotion or hiking salary, everything. All decision is taken by the supervisor or principal. Next, leaders. Okay, so these are all the method. What are all those methods? I told you first. There are 7 methods. First one, traditional rate. Sorry. First one is self-appraisal. Then appraisal by others, rating on appraisal by the supervisor. Third one is trait rating scale. Fourth one, checklist. Fifth one is essay. Sixth one, peer review. Last one, performance appraisal interview method. Okay. Next, let us move on to leadership roles associated with performance appraisal. Okay. Here, the supervisor or the principal leadership roles. What the role? How he or she is supposed to be? In front of the employees or among the subordinates. Okay, here I forgot to tell you one thing. So these 7 methods are widely used in the clinical setting. Okay, even some settings are used in the educational setup. I will just enumerate or list out some of the methods are used in the educational setup, like anecdotal. Okay, anecdotal method, then checklist, rating scale. There are rating scales like a numerical rating scale, graphic rating scale, descriptive rating scale, frequency rating scale. Okay, these 4 types of rating scales are used. Fourth one, behaviorally anchored rating scale. Behaviorally anchored rating scale. Then fifth one, ranking way. Then sixth one, management by objectives. Okay. There are 6 methods are there, or 6 methods of performance appraisal tools are used in educational setup. Okay, what are all those? Anecdotal, checklist, rating scale. In that, again, 4 classification: numerical rating scale, graphic rating scale, descriptive rating scale, frequency rating scale. Okay, fourth one, behaviorally anchored rating scale, ranking. Then last one, management by objectives. Okay. So these things are self-understanding. I hope you will be studying or discussing in detail in your classroom setting. Now, since there is no much time, I will move on to the next slide. Leadership role associated with the performance appraisal. So what is the leadership supposed to be shown by the supervisor or who is the evaluator? Okay. First one, to motivate the employees and promote growth. Always supervisor as a principal in an educational setup, they have to keep motivate the employees for each and every small achievement, the performance which has been carried out by the employees. We have to keep motivate, encourage, support, and always we have to help the staff for for the achievement, for all the innovative ideas. We have to welcome them, and we have to appreciate each and everyone for the small tasks or whatever the innovative ideas. Next, to reduce the anxiety inherent in the appraisal process. Okay, being a supervisor is supposed to be very friendly, and being approachable. Very approachable. Okay, they are supposed to reduce the anxiety. They are not supposed to be scolding. They are not supposed to use scolding or some verbal abuse. No, they are not supposed to use. Okay, to reduce the anxiety inherent in the hospital appraisal process, they have to be very friendly, do interview or evaluating the staff. Next one, to promote the employee growth in work performance. Always we have to promote the employee's growth. For example, we have to discuss with the employees what is the personal growth and the professional growth. Okay, personal growth and professional growth. Everyone have their own personal family problems and their personal problems, health problem, many aspects. Okay, so we have to discuss with them and ask them, counsel them, educate them, guide them, and professionally how they can empower their knowledge and how they can be helped to upgrading their knowledge. Okay, that identify and help them. Fourth one, involves employees in all aspects of performance appraisal. Okay, involve all employees in all aspect of performance appraisal. Okay,
start.
All aspect. I told you, 5 dimensions. Okay, their personality, behavior, communication, the way of the nursing care has been carried out, following all ethical practice, professional advanced professional skills, their research ideas, educational upgradation, all the things, all aspect, performance, the performance appraisal supposed to be. Then that is the role of the leadership. Okay, next let us move on to the recommendations for conducting an appraisal interview. Okay, so how to conduct, these are all the recommendations for the supervisors, how they can conduct the interview, how they can evaluate the employee or subordinates. Okay, first one, put the employee at easy, make the employees to feel comfortable, to feel approachable. Employees should be always pleasant. They have to feel that we can, we have to give freedom for them to ventilate their feelings. Okay, so to that end means that much, approachable environment, calm and quiet environment, and has to be given by the leaders. Clearly state the purpose of the appraisal interview, and it, as I said, the beginning of the session, the set the standard, and the standard or the job description supposed to be informed, reminded, and frequently reminded, update their job responsibility, and the quarterly, monthly, or half yearly evaluation supposed to be done. Okay, go through the rating one by one with the employee. Okay, go through the rating one by one with the employee. Rate them. To what extent they are graded. Okay, bad, average, good, very good, excellent, okay, outstanding. Okay, like that. So we are actually in our hospital, we are rated like in 5 dimensions, actually 5 concepts. How they are rating means novice. That means each aspect, I told you 5 areas where they are standing. For example, novice, that means beginning employment. They are new in role, does not yet meet the expectation. Then next one is advanced beginner, competent, proficient, expert. So these 5 component, okay, are the performance rating key are given while evaluating. Fourth one, draw out the employee's reaction to the rating. Draw out the employee's reaction to the rating. Okay, after rating, just what is the reaction? Oh, if the staffs are feeling comfortable, or if they are performing above 80 or 90%, they are feeling happy. Or if they come to know that your rating is very low, they will be very annoyed. They express like this, the picture how they show. So we are not supposed to give that environment for the staff or employees to feel like this. Okay, next one, decide on specific ways in which performance areas can be strengthened. Okay, specific ways in which performance areas can be strengthened, that has to be keep it in our mind. Okay, set a follow-up data. We have to keep follow-up data for evaluating. Then express confidence in the employee. As a supervisor or evaluator, express the confidence in the employee. Okay, make them to feel comfortable and free to express their views, ideas, and their feelings, problems, and what is their innovative ideas. That has to be listened in a proper way, in a comfortable manner. So that was the recommendations for the supervisors to be how the evaluation can be done. Next one, points are to be kept in mind for appraising fairer and more accurate assessment. Okay, there are some points, certain points to be keep it in our mind in order to accurate assessment. Okay, first one, the appraiser should develop an awareness of his own bias and prejudices. Okay, his one, they are not supposed to use any bias or prejudice. Okay, next, a consultation should be sought frequently. Then information should be gathered appropriately. Information should be written down and not trusted to memory. Okay, these points are supposed to be kept in mind in order to fair and more accurate assessment. Okay, as a supervisor should be open-minded and written everything very clearly, and not supposed to be shown any bias or prejudices, or should be convey properly, gather appropriate information, then you evaluate our subordinates. Then collected assessment should be contain positive examples of growth and development achievements areas where development is needed. Okay, we have to collect the proper information, and then whatever the positive points or the development achievement areas where the development is needed, that has to be communicated. Then appraiser need to guard against the three common pitfalls of assessment: hollow, horn, and central tendency errors. They are not supposed to use any kind of there are many chances to error, okay, that they are not supposed to use. Okay, at the same time, they are not supposed to evaluate all the stuff in the same level. Okay, you might be studied various the errors. Okay, evaluating errors, we can discuss more about that. Since we have no time, I'm just skipping. Okay, some effort must be made to include the employee's own appraisal of his other work. Okay. Then sound appraisal program must satisfy the following basic requirements. The system must be consistent with the management style and philosophy, work technology, socio-cultural characteristics of the individuals concerned. Second one, it should be tuned with other personal programs such as the system of reward, compensation scheme, training program, etc. Third one, the technology in use should have the cooperation of the appraisals. It should have the ability to assess in as objective manner as possible the performance and the effectiveness of an individual as related to his job. Okay, the sound appraisal program supposed to be first the basic requirement. Okay, then now the time to conclude my topic. Till now we have discussed in detail about the performance appraisal system, the definition, purpose, principles, components to be evaluated. Then in detail we have discussed about the methods of appraisal system. Then some of the leadership roles and recommendations and some points need to be kept in mind. Okay, some considerations while evaluating. So all those things we have discussed. So despite from numerous problems associated with appraisal, most organizations continue to have the formal appraisal program. It is hence clear that the alternative to a bad appraisal program at all, but it can and ought to be a better appraisal program. Okay, so keep it in your mind. So these are the reference which I have used to collect information. Just you can go through. That's all. Here I conclude my topic, performance appraisal system. I hope you all might be at least a little information through my explanation. Thank you so much. Is there any questions? Hello everyone, good afternoon.
Thank you, Swami Vin.
Thank you, ma'am.
Yes, as you have clearly told about performance appraisal, it is a very important tool in the quality institutes, because
Yes.
it's not only for that academiciation, it is all the level of the employee should be assessed through the performance. The
Yes,
appraisal is needed. It's not finding the negative things. We want to know about what is the capability to improve yourself. So it's a very
Exactly.
important tool.
Exactly.
You have told clearly all the attributes, how to that overcome. It's a very, very needed scenario in nowadays in all the institution. Thank
Yes,
you once
madam.
again
You are
for your
exactly how
crystal
told.
presentation. Yes.
Thank you, ma'am.
And
Thank you.
dear participants, you have any queries, you can post in the chat box.
I think I have taken few minutes extra. Sorry for that.
No issue, no issue. Due to the network issues only, it has happened everything from starting.
Exactly, ma'am.
We will rectify. Tomorrow it will not happen. I think no chorus in this today's session. Thank you, Swamivel. Thank you, Pechiamal ma'am, for your wonderful presentation and also your timely crisp presentation. Thank you all the delegates. Tomorrow's session will start at sharply 10 o'clock. Join 10 minutes before the session tomorrow. I request all the participants to fill the feedback form daily. It should be it is mandatory to everyone. Thank you once again.
I want to tell something.
Yes.
I want to thank the principal, Dr. Maheshwari ma'am, vice principal ma'am, all the teachers and students for giving me on a wonderful platform to talk something about the performance appraisal system. I'm really grateful that I'm very proud of that. I studied from VMACON Mission's Annapurna College of Nursing. Every day I remember our college, the platform, given me an opportunity to gain myself, to upgrade myself in many aspects. All the teachers, very good support. I remember Dr. Selvanagi ma'am, even Dr. Maheshwari ma'am, all the teachers, most of the teachers are still working. I thank everyone, all the organizers and everyone, all the teachers. Thank you so much for this platform to view my point about this performance appraisal system. Thank you so much, ma'am, for this.
Thank you, Mr. Swami. We are also more proud. We are very much proud about our alumni. We feel more happy to see you in this platform. Thank you once again. Thank you all the delegates.
Thank you. God bless you all, ma'am. And be safe from Corona. Take care of yourself, your family members, and others also by following the Corona precautions. Thank you all. Thank you once again. Thank you so much.
Thank you. Thank you to all. Thank you, dear delegates. We'll meet tomorrow. Thank you.
Thank you, ma'am. Thank you.
Baba.
Hello, Swamivel. Hello.